Mr. Chairman, and thank you, Dr. Gulin, for the great, excellent introduction. As we speaking from the non-communicable disease perspective, the area of health workforce is very critical for the NCD prevention and control. You rightly mentioned in your technical paper, there is a lot of shortages in the region, which we cannot achieve a good quality of non-communicable unless we need to address the gap of shortages of health workforce. So in addition to what you have mentioned, there is something, there is a lot of other shortages related specifically for uneven distribution of workforce in related to non-communicable disease, where we can see that most of the expert or NCD expert are in the urban area versus the rural area. There is inadequacy in NCD services, particularly in the remote countries or remote parts. Training program for healthcare provider often lack focuses on non-communicable disease, early diagnosis, and also on comprehensive treatment. And in this regard, I want to refer to the example of palliative care. We have a lot of shortages in palliative care and psychotherapy and counseling for non-communicable disease, because if we want to promote health promotion and early screening. We have also shortages on a high workload and burnout and inadequacy of incentive for people working in this area. So in light of these all challenges and gaps you have rightly mentioned in your paper, in member state, we are calling for colleague and your excellency in countries to invest in NCD specific training and continue education of healthcare professional, particularly those professional working in the primary healthcare settings. Primary healthcare is a cornerstone for NCD prevention and control. And we want to also to encourage the integration of non-communicable disease into the curricula and into the services.
Thank you very much.
Thank you very much. And we support the guidance and assistance by WHO in this area, which is very critical to address the gap in the region. Thank you.
Thank you very much. شكرا جزيلا.